Okay, this case was sent in for advice. Patient really wants aligners. Fair enough. So we've got quite socked in buccal segment, and we've got a bit of crowding of the upper arch and some more crowding of the lower arch. So more crowding in the lower than the upper, and that's probably down to the fact it could well be a Bolton issue. Now we could do aligners, but again, it's getting the whole story. So I'm just mindful of the breach of duty that occurred a few years ago in Australia, where the patient won loss of earnings. She used to play the flute as a profession, and the clinician didn't ask her about what she did. So she had upper and lower fixed appliances, which affected her lips. Okay, the majority of patients, it wouldn't make a difference. But she was a professional flute player, and those with very acute hearing could pick up the differences in the notes she could produce, and hence the clinician lost the case because he didn't do true informed consent. So getting back to this case, okay, we can do aligners, but it's going to take some time. And the reason it's going to take some time is, if you notice the long axis of the tooth, if you just simply relieve the crowding by proclination plus or minus IPR, because we're not really an extraction case, we're going to have a triangle here. We need to move the apex of the tooth measly, so upright the tooth, so it's got to move quite away. Similarly on the canine. Now, some people would simply, and I've seen it done in numerous medical legal cases, do IPR. So it's just a bit tricky trying to watch the camera and do this at the same time. So they do simple IPR, and you can see you're going to end up with somewhat of an odd shaped tooth, almost triangular as it comes down. So we're going to need some attachments. I quite like chunky attachments to move that round. But then she throws a little bombshell in. I mean, we should ask for what purpose. Everything's for what purpose. She's getting married, and she's going to get married in approximately 8-9 months. Now, tipping is a simple action, but uprighting the apex has got to move a long way through bone. It's going to take time. For me, I'd much rather have, because as Prophet would say, the secret to fast tooth movement is a low continuous force. So for me, this is ideally a fixed appliance case. We could do aligners, but it's going to take a lot longer, because we all know, as House would say, patients lie. They never get the full wear. And the attachments help increase the wear, because I remember people said, I just can't be asked to take them out. Especially when you've got nice chunky attachments, it really grips in. So for this case, I would recommend fixed appliances, ceramic, tooth coloured. Simple as that. And then she should be done in time. If she's not, because part of the consent is that we will still take it off and make you some refinement aligners, because you'd be very close. So that's that. I'm just sort of chuckling or moaning to myself. I hate it when people send me models for opinions. Just buy a scanner. It's so much easier. And then I can do a virtual setup for you, which you can then show the patient to help educate them. Because that's the thing, you don't have to try to convince the patient, you just give them it in black and white, educate them, and all of a sudden the decision's made. So it was meant to be a quick video, but I've been rambling on as per usual. So yeah, it's the little things that catch you out. Always the little things. And with that, see you soon.